What is the difference between good plastic surgery and botched plastic surgery? Good plastic surgery, think awake, refreshed, imperceptible. Botched plastic surgery, noticeable, change in appearance, deer in the headlights. Those are the kinds of things that kind of separate those two categories. How can you avoid getting botched plastic surgery? Well, number one, if you want to get your eyelids done, go to a qualified plastic surgeon, or even better, an oculofacial plastic surgeon. I'm an oculofacial plastic surgeon, and that means that I only operate on the eyelid area all the time. So if you go to somebody who's qualified, you're more likely to get a better outcome. Number two, ask the right questions of your surgeon. The first question you want to ask if you're talking about something like a brow lift is, where are my incisions going to be, and what part of my eyebrow are you trying to lift? Because honestly, in my brow lift practice, 99% of the time, I'm only lifting the outer brow because I want to pull the brows up and out because that gives more of a sign of youth. The last thing you want to do is make the inner brows higher than the outer brows. That's straight up deer in the headlights. It can make people look really unnatural when you try to lift just the inner brows. Second and related question you want to ask your surgeon is, do I need more volume? Am I hollow anywhere that needs to be filled? For example, am I hollow in the inner upper eyelids naturally or from a young age? Because you don't want to accentuate that. It will make you look kind of overdone. The real way to understand this is to understand what happens with facial aging. Most people think you just get wrinkles and everything just droops over time. That's not really the case. Think about your face kind of like a balloon, if you will. And the balloon, if you just take a tiny little bit of air out of it, it's going to form some wrinkles and it's going to deflate. So what happens in your face is some of the fat compartments of the face kind of atrophy or deflate over time. And then there's sort of sinking of some of the tissues because that balloon has lost some of its volume. So adding volume back in can be helpful. So we as surgeons can kind of target areas that have lost volume over time. Typical areas for that are under the eyes along the cheekbones, the temples, the eyebrows, and sometimes I'll even volumize the inner upper eyelid to reduce the appearance of that A-frame or that hollow there. And that can really help in terms of making people look less aged over time. Good plastic surgery should give you more facial harmony, restore balance, and take a look at some of the pictures from your youth to try to restore those areas. It's kind of a fine line between subtly altering someone's appearance with good imperceptible plastic surgery and dramatically altering somebody's appearance, which that's what you want to, I think, avoid with plastic surgery, at least for most people. And if you go to a good plastic surgeon who cares about these things, you'll be able to do that.